everyone. Welcome to our Monday Minute. Today, we're going to discuss the end of the public health emergency, which has technically not been officially announced, but the White House has said it will be happening. So on January 30th of 2023, from the White House, it was stated that there will be an extension of the public health emergency through May 11th. And on May 11th, the public health emergency will officially end, extending it to May 11th to officially give the 60-day notice that the White House had promised previously. So the reason we're here to discuss this today is to primarily ensure that you understand the significance of some of the things that you have been using in your day-to-day practice of your organization as a part of the 1135 waivers put in place in March of 2020 that will now cease. You will not have access to those anymore. So let's start with telehealth. Telehealth has been in home health, a part of home health and hospice for years, not used as much as it is today. Or it was during 2020 and 2021, but still does exist. The primary component I want to reiterate is that we had been approved upon the public health emergency beginning to provide telehealth visits via for face-to-face encounters via audio, video telehealth. That is for both home health and hospice. That was originally put into the flexibilities a few months ago that telehealth for face-to-face encounters would be allowed for an additional 5 months after the end of the public health emergency. And then in the omnibus bill that was passed at the end of 2022, they passed in that bill that telehealth could be utilized for home health and hospice face-to-face encounters through December of 2024. So you will still be able to conduct face-to-face encounters via telehealth through December of 2024, even though the public health emergency will end in May of 2023. Another very key factor is the home health situation with therapists being allowed to do the start of care. So currently under the 1135 waivers, if there is an order for skilled nursing and therapy, therapy is allowed under the waivers to conduct the start of care comprehensive assessment instead of a nurse. As of the end of the public health emergency, that will no longer be the case. So once we reach May 11th, if it does officially end as they have stated, you will no longer be allowed to have a therapist do a start of care comprehensive assessment of a home health patient if nursing has been ordered. It will default back to the original current OASIS requirements. In addition to that, I do want to point out that they do intend to continue to reimburse both home health and hospice for COVID-19 vaccinations to your patients. In this minute, we will provide the link to the flexibilities that have been outlined. Be careful because with those flexibilities for home health and hospice, they may not have yet included the language for the face-to-face encounter to be extended via telehealth through December of 2024. So just make note that that is the case. All the other flexibilities that you will read at these links will be in effect with the end of the public health emergency. Please begin planning now for any of these waivers, including multiple ones regarding home health aid, supervision, etc. All of those are going to end on May 11th, and you will go back to the original requirements for home health aid supervision, annual training, etc. And again, those will be included in those documents that we will provide the link to. I hope you have found this helpful and that if you need any assistance as you prepare for the end of this public health emergency, please don't hesitate to let us know. Have a great day, and we will talk again soon.